Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you for joining us on the program today. Our guest in studio is returning to speak with us, Mr. Sacha Loiseau. He's the president, CEO, and founder of Mauna Kea Technologies. He started the company back in 2000, and he's here today to talk with us about the Cellvizio product line. It's a product line that's making great strides in the treatment and diagnosis of cancer, certain types of cancers. And Sacha's in studio today to talk with us about why physicians and hospitals would want to choose Cellvizio. Welcome to the program, Sacha.
Thank you, Neal. Thank you for having me.
Thank you. You know, your background is very interesting in that you started out in astrophysics, looking toward the skies, and now you're looking within in the smallest way possible. Talk about your background and how it relates to the founding of Mauna Kea.
Yes, indeed. I was an astrophysicist before creating this company about 15 years ago, and there is a very strong technological connection between looking at the stars and looking at the at space, and of course looking at the inner space. And making a telescope and making a microscope is not very different optically. So that's what we've done, and we've applied techniques that really emanate from astrophysics, and with a very multidisciplinary angle, we've taken the microscope inside the body of the patients. And by doing so, we are providing physicians and surgeons with a completely new way of looking at tissue. And, it's a very relevant vision that they needed to have. And of course, which was done previously, but not inside the patients, but outside the patients in a laboratory. So we're really bringing the lab inside the patients.
So my understanding of certain types of cancers, you do an invasive biopsy, and then you analyze the tissue from that biopsy. Why would a doctor or a hospital want to use Cellvizio as opposed to what's been working for them so far?
Absolutely, a very good question, of course. So I would say the answer is that over the years, after conducting many clinical trials which have been published, we've received a very strong support and endorsement from medical societies. So, for instance, you're talking about biopsies. Well, if you go on the College of American Pathologists website, you can download educational flyers of why using endomicroscopy is better for patients, simply because targeting biopsies with an in vivo microscope is going to get to provide a much better yield of biopsies. So all this is very well explained, and recently we've even received a strong endorsement from the American Society of General Surgeons, clearly stating that to get a comprehensive assessment of the nature of a pathology inside the stomach or the esophagus, typically with a patient who suffers from reflux disease and possibly already from Barrett's esophagus, using endomicroscopy to quickly assess the gastroesophageal junction is proven to be much more effective, much more sensitive, and much more specific than existing procedures, either simply based on visual assessment with an endoscope or with one or two random biopsies taken at this location. So I think that's why we feel very confident that we have now proven the effectiveness of using endomicroscopy, of course, in certain applications today and in more and more applications tomorrow.
Now, effectiveness as far as health is concerned, that's one thing, but what about cost effectiveness? How does this technology pay for itself, it being better than the norm?
Absolutely. So we've been very fortunate, and again, thanks to the quality of the clinical trials that were conducted and published, to obtain new CPT codes from the American Medical Association. And so the procedure using our technology, endomicroscopy, typically in the esophagus or the stomach, is a reimbursable procedure in a hospital or in an ambulatory surgical center. And so there is today coverage nationwide by Medicare, Medicaid, and certain commercial payers are now covering, and we expect more and more to be covering the service. And thanks to the recent recommendation we obtained from the American Society of General Surgeons and the support from other societies, we clearly expect this coverage to really be more positive in the future. So I think this is how physicians and surgeons and hospital administrators can feel confident that adopting Cellvizio is not only better for their patients, but is also going to be better for their practice by just simply allowing for a better procedure that is reimbursed in the future.
Now, at your website, MaunaKeaTech.com, you offer support and information on the Cellvizio product line, as well as separate training for physicians. Does there exist some training for the physicians to help their patients understand and to trust this new technology as they trust their physician in the first place?
That's a great question. Yes, so we have not only a fully educational website, which is called Cellvizio.net, on which not only physicians but also, of course, patients can register and look at the educational materials. So physicians can get training. They can even connect with experts and with us, of course, so we can connect them with regional experts if they need to. We also have a patient website. For instance, we actually have a couple, some of them dedicated to educating patients on, possibly what kind of treatment they can get if they suffer from Barrett's esophagus or from reflux disease, or if they have a pancreatic lesion, what they can expect from different procedures that they might have to undergo to get to a characterization of the lesion. So I think all this material will help physicians and patients alike get a better understanding of how they can get a better service, if you will.
Have you received any feedback, or does this feedback exist as far as military applications, say in military hospitals, or even in an in-combat situation where some type of need for that exists? Does Mauna Kea have any eye on the future as far as that's concerned?
So that's a very interesting thought. We're present in VA hospitals, and we're very proud of that. We've actually thought about what you're saying, because obviously in combat situations, you cannot have a pathologist on site. You cannot have so many things that you have in a hospital. So by providing digital in vivo microscopy, which is what we do, we can typically provide a means to connect typically a combat zone with somewhere else where they have the information, the people who can process the information more adequately. So I think in the future we will have a place there, possibly integrated into other systems and platforms. For instance, we have shown that we can work very well with surgical robotics. And so surgeons already are combining Cellvizio with surgical robotics to get a better, to make a better procedure. So this can typically be in our future. I really think so.
Well, Sacha, some exciting possibilities. It's been a pleasure speaking with you in studio today.
Thank you so much, Neal.
Thank you. You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Mr. Sacha Loiseau, CEO and co-founder of Mauna Kea Technologies, developers of the Cellvizio product line. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.